Why is it important to be aware about blood cancers? As I said, all these three varieties of all the tumors or cancers that affect the older patients or adults, blood cancers are the ones that can be treated. They can actually be detected. If they're detected early, they can actually be controlled aggressively. They require a lot of chemotherapy and intensive chemotherapy and regular follow-ups, which lasts over a few weeks to a few months' time. But if the diagnosis is made at the right time and the treatment is started at the right time, then a lot of these patients can actually be cured. Especially lymphomas in the elderly, lymphomas in adults can definitely be cured after 6 cycles of chemotherapy and requires regular follow-up after that. Even myeloma, for that matter, requires you to come to the hospital or daycare for maybe once a week for a few weeks, following which treatment would be complete in the elderly, after which few tablets or injections may be required. In the younger patients with myeloma, they would require slightly intense or higher intensity chemotherapy followed by autologous bone marrow transplant. Younger patients with leukemia, if they have acute leukemias, they would require bone marrow transplant as well after chemotherapy, depending on their response to chemotherapy. If it is chronic leukemias, as I said, it's important to be detected, but the treatment is very simple. Most patients with CML are usually started just on a tablet, and they stay on that tablet for 5 years to 10 years, some of them even for a lifetime. Patients with CLL sometimes don't even require any treatment if their counts are normal, or if they don't have any large liver or large spleen, they don't have significant, we call it the somatic symptoms, they don't really require any treatment. They can, or if they do require treatment, it's a few injections and maybe a few tablets and the treatment is completed. If you have any further questions, as I said, blood cancer can be anything ranging from a deadly disease that can be life-threatening to a simple disease that might require you to take a few tablets or just be on observation. So make sure to be evaluated by a physician or by a hematologist, somebody who knows how to diagnose and treat blood cancers. If you have any further questions, kindly feel free to reach out to me. I'm Dr. Neema Bhat, hematologist and hemato-oncologist. Thank you.